Talk about prenatal care with vaccines, diets, and medications to avoid. We must educate mothers on a variety of information, starting with how to avoid certain medications. The first top tested one is NSAIDs. NSAIDs are considered unsafe during the third trimester of pregnancy, as they can prematurely close fetal heart structures. So to help you memorize all the NSAIDs, we use the acronym NSEC. N is for naproxen. Guys, this is the most commonly tested NSAID on the NCLEX. S is for salicylic acid, generic name aspirin. A is for aspirin. So yes, we said it twice because it's so nice. No, it's always top tested, guys. Now, I is for ibuprofen or indomethacin. This is the second most common tested. Well, second and third. And K is for ketorolac, also called Toradol. Now, the next big category is ACE inhibitors and ARBs. Look at the A's here. We want to avoid these during pregnancy. Now, these end in pril, like lisinopril for ACE inhibitors. So the memory trick is no prils during pregnancy. And ARBs end in sartan, like losartan. So the memory trick, just think sartans are like Satan to pregnancy. Very harmful to the fetus. The next drug is doxycycline and tetracycline. See how they end in cycling. So just think, cycling on a bike is dangerous during pregnancy. And lastly is carbamazepine. This is a seizure drug, so it should not be taken either. Just think, carbamazepine is like messing things up during pregnancy. So please be sure to pause the screen and write down these top tested drugs and know not to give them during pregnancy. Now, switching gears to vaccine safety. Remember, pregnant clients have a suppressed immune system and are at increased risk for illness. In general, no live vaccines are given during or even up to 1 to 3 months before pregnancy, as live vaccines can cause serious birth defects to a developing fetus in utero. So please be sure to write these down. We have safe medications, or safe vaccines rather, during pregnancy, and not safe, no live vaccines. Okay, so starting with what's safe during pregnancy, we have inactivated influenza, that flu shot. This can be given during pregnancy, and the key term is inactivated. Remember, no live vaccines during pregnancy. The next big one is Tdap vaccine. This can be given 27 to 36 weeks, and these include the following: T for tetanus, D for diphtheria, and P for pertussis. This helps to prevent pertussis, that whooping cough, in newborns. Now, what's not safe is no live vaccines. It's only safe after pregnancy, like during breastfeeding after pregnancy. So please be sure to write these down. These are always top tested. So first up, we have varicella zoster. This is basically the chickenpox vaccine. The next one is rotavirus, and any live or activated influenza vaccines. Remember, we cannot give live vaccines. And the last one here that's always top tested is the MMR, measles, mumps, and rubella. Now, MMR, especially rubella, was a big one that's mentioned a lot by ATI. So we have to teach clients to not get pregnant for at least 1 month after this MMR vaccine. All right, now let's see what the question banks have to say about this. So ATI questions. Question number 1, 30 weeks gestation. Vaccines are considered safe while we have tetanus, diphtheria, and pertussis, that Tdap. Now question 2, routine education for a pregnant client. Get a flu vaccine to protect against influenza infection. Yes, as long as it's not a live flu vaccine. Now, HESI question here. Education for a postpartum client before administering varicella vaccine. You must return for a second dose in 4 to 8 weeks and use contraception for at least 1 month to avoid pregnancy. Now, moving on to newborns and vaccines. We often give RhoGAM 72 hours after birth to Rh negative moms with Rh positive babies. This is done to prevent the formation of antibodies in the mom and also to protect future babies if mom decides to get pregnant again. The next one is hepatitis B vaccine. This is given to newborns with infected moms. The key term there is infected moms. It's given within about 12 hours to mom who is hepatitis B positive. All right, now for all the NCLEX tips on education for pregnancy. Be sure to write down the bolded and highlighted ones here, as these are big NCLEX tips. Obviously, we're going to avoid alcohol and tobacco products, which is never good on the NCLEX or any exams. Next, we obtain testing for rubella immunity. Rubella immunity is a top tested one. Next, schedule dental wellness appointments. And for the second trimester, be sure to write this down: gestational diabetes and preeclampsia screening. Anticipate quickening or light fetal movements during that second trimester. This was also top tested. And another one here is abdominal ultrasound evaluation for fetal anatomy and placenta assessment. Now, in terms of weight gain, what is good during pregnancy? So write this down. Expected weight gain is 25 to 35 pounds during pregnancy. The big key term, or the big key numbers here, are 25 to 35. And maintain a BMI of 18.5 to 24.9 kilos. And lastly, we want our clients to gain about 1 pound per week if pre-pregnancy BMI was normal. This is done in the second and third trimester. So overweight women should seek to gain less, and underweight women should seek to gain more. This goes for women of all ages. So Kaplan had a question here. By the 5th month of pregnancy, the client has gained 14 pounds. Inform the client that the weight gain is appropriate. Next is diet and vitamins. This one is huge. Folic acid has to be key number 400 micrograms per day. Guys, it prevents neural tube defects like spina bifida. So be sure to know that key number, 400 micrograms of folic acid during pregnancy. The next one is calcium, 500 milligrams per day. And iron-rich foods like meat and dried fruits. Meat and dried fruits were top tested, as well as supplements. This is done to prevent anemia. And this takes place during the second trimester. We must teach clients these 3 key points. So please be sure to write this down for iron administration. Take on an empty stomach, you have a risk for constipation, and increase vitamin C to aid in absorption, like drinking orange juice. But the big key point here is don't take vitamin C at the same time as an iron supplement. Always take iron on an empty stomach for best absorption. So ATI had 2 questions here. Question 1, folic acid deficiency. Which of the following complications? Fetal neural tube defects, like spina bifida. And question 2, ferrous sulfate, which is just fancy words for an iron supplement. Which of the following beverages increase the absorption of the medication? Orange juice. Yes, remember, vitamin C increases the absorption of iron, just not at the same time. And HESI questions here. Question 1, pre-pregnancy instructions. 400 micrograms of folic acid daily. And question 2, risk is associated with iron supplementation for the pregnant client. Constipation. Yes, you might get backed up in the restroom. Now, in terms of protein foods, rich with calcium, iron, and B vitamins. A great meal, for example, would be grilled chicken, turnip greens, peanut butter, as well as juice. Now, this is a huge NCLEX tip that came up a few times. Even HESI had a question here. Which examples of protein-containing foods for a vegetarian client? Dried beans, seeds, peanut butter, there it is, and peas. And ATI, 8 weeks of gestation, good source of calcium, dark green leafy vegetables. Now you guys are going to see it a lot. Dark green and leafy veggies are usually the most correct answer here. Typically comes up a lot on the NCLEX. Now lastly, foods to avoid during pregnancy. Unhealthy is excess salt, butter, fat, and even margarine. And unsafe dairy, be sure to write this down. Unpasteurized or suspicious, like brie cheese or brie cheese, raw milk, deli-made egg salads were a big one there. So HESI mentioned this. Which foods should the client avoid during pregnancy? Brie cheese, unpasteurized milk, and deli-made egg salad. All right, that wraps it up. Thank you so much for watching. Don't forget to take your quiz and download the study guides. And also feel free to share the love, share with a classmate, and even your instructor.